All
Hi.
right, so I'm Adam Gomez with Moxie Mentoring. I want to introduce my guests, John and Dave. John and Dave are with Kamana Health. You guys want to go ahead and introduce yourselves? Tell us a little bit about each of you and a little bit about your business.
Yeah, certainly. I'll let John start.
Yeah, I'll start. Hey guys, I'm John Modica. I'm one of the co-founders of Kamana Health. My background is in nursing. I've been in the ER for about a decade now, with the bulk of that time as a traveling nurse. Awesome career. Got to go all over the country. Got to work with some awesome staffing agencies. Through that experience, just a lot of frustrations around, the way that I'm managing my documents, the way that I'm getting that data over to my recruiters, and a lot of pain points there that, it took kind of Dave's outside perspective to see and got us kind of headed down this path. But yeah, I'll let you introduce yourself, Dave.
Yeah, sure. So Dave, John and I have actually known each other for 15, 16 years. We've been friends a really long time. And my previous kind of work before Kamana, I was working for a healthcare company that I kind of got in really at the early stages, and we did data migrations for hospitals and had about 250 nurses working for us. So I've always worked with nurses in a very different capacity, but that job actually afforded me the ability to be remote a lot of the time. So I would go visit John while he was on all these travel assignments. And me and my partner would go visit him and his wife in Tennessee and California and Alaska, and really just spending a lot of time watching the way that he manages this part of his career. We first started looking at it from like, hey, let's get online and find a way for you to maybe navigate this a little better, and couldn't really find one, so just decided to form a company around it and try and make like a big positive impact on the industry here.
I love it. What a great story. So, John, where was the coolest place that you went to as a traveler?
Oh man, probably Anchorage, Alaska. And like Dave said, him and his partner came up, so it was all four of us there for about 2 months. They were there with us. We're
crammed into his one bedroom apartment.
Yeah, but I mean, we wore out 2 rental cars while we were there. We just drove all over that state, saw all that stuff. But yeah, really beautiful country. So that was last summer that we were up there. So that was a good last travel assignment. But I'm excited to get back out there.
Sounds amazing.
Yeah.
So you mentioned, some of the struggles that you experienced, I guess, as a traveler, and some of the frustrations. Can you be more specific, kind of give me an idea of kind of, what form that took on for you in your experience?
Yeah, for sure. So I think it started with like, I felt like I was a good nurse, right? I feel like I'm a good travel nurse, but I never felt like I was good at travel nursing. Like I always kind of would be panicky if I didn't have my folder of all my certifications and licenses, and trying to keep my really pathetic resume up to date, and get on Microsoft Word, and just the format looks terrible. And then what would happen was, I would get a call from a recruiter, and they would say, hey, are you interested? What are you looking for in your next contract? And, I was always open to talking to other recruiters and exploring other options. And there would be times when there's that great opportunity and I can't get my stuff together quick enough to get it over to them. And I go through that process, and then I miss out on an opportunity. So there was kind of frustrations with that transfer of data. And then, on a more personal level, things like if I'm on contract in Alaska, my recruiter, my team may not let me know that my Tennessee license is expiring. And I don't think that it should be their responsibility. So just being a better way for myself as a professional to keep track of those documents, keep up to date on my expiration reminders, and then, like keeping track of all my medical records. Like I've had to get vaccinated for MMR again because I lost my last titer or my last vaccine. So just I needed a tool to be more organized as a professional, a way to keep track of when stuff's expiring, keep it all in a kind of digital wallet. And then when I connect with that awesome recruiter, I can move that information over in a way that's secure for me, that's protecting my info, but also gives it to them in a nice, organized, clean packet, so that it maybe sets me a little more competitive against my peers.
Great. Yeah. I mean, I know for years, as a recruiter, that was the constant battle that we were faced with, right? I mean, so on the recruiter side, we're like, what do you mean you don't have a resume that's updated?
Yeah.
You're looking for a job. Why don't you have your resume updated? Or why don't you have these documents, these health documents? You've been vaccinated. Where's the documentation? So that's great. I think that you and I would have worked well together, John. Just the fact that you wanted to be organized is a positive. So yeah, I love it. I think there's absolutely the need for this type of technology in the space. And speaking of technology, how do you see technology impacting the role of the recruiter and the interaction between recruiter and traveler? And do you see things changing? I know there's a lot of chatter out there about these recruiterless models. And I mean, what's your take on that?
Yeah, good question. And I'll start and maybe let John piggyback. But
Sure.
So from our standpoint, we've had the fortune of actually being able to kind of pay attention to everything that's going on in the market and really take our time, like talking to our users, talking to our potential users, and through all these observations have seen, it's very, very evident that, I mean, the human element in recruitment and in staffing, particularly in healthcare, it's not going anywhere anytime soon. But what does need to go away is the fact that recruiters are out there having to manually hack together resumes for John, and then manually hack together different versions of his resume to go into different VMSs and different MSPs, and all of this like manual work of all of the paperwork, and then all of the kind of cold calling, all of the cold emailing, all the texting. I mean, just all this stuff that's not really efficient for both sides is where we think technology has the ability to come in and make a big impact. And where we really see, our strengths is like, we have been observing these staffing agencies now as a company for a year, John for a decade before that. And like running a staffing agency is really hard. There's a lot of work involved. To get people where they need to go, and to deal with the fires, and to kind of deal with all the client management. And through that, I mean, we think that we've got the unique ability to come in and say like, hey, you're really good at running a staffing agency, and we couldn't do that if we tried, but we're really good at running a technology company. And if we can come in and be your technology team and bring you the solution that's going to power your industry, and you bring your recruitment expertise, we bring the technology expertise, and with those two things, in the mix together, we think we've got the ability to really streamline and improve some ways in the industry, and come and improve upon, I think, some of the things that some of these like technology-driven companies are lacking.
Yeah, I love it. I think that you're spot on. I think that when we're talking technology, we're talking, how can we improve efficiencies? That's really the goal of technology, right? We want to make the job, the recruiters more efficient in their job. And in doing that, we can create, an optimal experience for the travelers, for the clients, for the leadership team, for everyone involved. John, I think I kind of cut you off there. Were you going to add something to that?
Yeah, I think, the human element is I mean, it's just vital to healthcare staffing. It's, at the heart of it, and it goes even before when I'm on contract with you, Adam, and I'm having that issue on a Saturday at noon, like you're going to be there for me. But I think it's even before that, like there's a constant churn in this market. Travelers come in and they come out. So there's just a constant influx of brand new nurses to traveling, and it's a complex space. And we get questions even today from our travelers that are using our tool that are like, hey, how do I do this? And where should I go for that? And it's like, that's a great question for a recruiter. So I'm going to connect you with an awesome recruiter, because, even doing travel on my end, even studying this market, there's a lot of complexities, and you need that educator that can come in and educate you on how to manage your career. They can set expectations. They can, I've had recruiters that I think I want this, and I'm talking to them, and they kind of get to the root of what I'm looking for, and they find an even better contract that I didn't, think about. So just that two-sided relationship, I think it's really, really meaningful, and I don't think you're going to replace that with technology.
Well, we're all in agreement on that one.
Cool.
So what, talk to me a little bit specifically about what your product looks like from an agency's perspective. What problems do you solve? I guess, to put it just in plain language.
Yeah, great question. So, Adam, we're a young company, so this is changing every day. But I'll start with where we are today is, we took all of this, we talked about this like digital wallet and credential management tool we've offered nurses, and we spent months, talking to thousands of nurses and making this just the best onboarding experience possible, and made it to where it doesn't matter if you're brand new into nursing or if you're just a really well experienced, career nurse that's, coming out and doing the end of your career in travel. We've made the platform where you can onboard and you can manage the thing from your phone, from your tablet, from your computer, and do that like no matter who you are. So from a user perspective, we're extremely focused on design, user experience, mobile capability. I like to tell people we're not mobile friendly, like we are mobile first. I mean, so like it can be done from your pocket or from your desktop. It doesn't matter where you are. It's a good experience. So we've taken that now and are now implementing that same technology to bring an onboarding, credential management, and communication tool directly to staffing agencies so they can implement this same user-friendly technology we're offering to nurses and turn around and offer it to nurses themselves.
Oh, excellent. Excellent. So that would be something then that potentially could, I guess, be connected or plugged into maybe their CRM or their existing ATS?
Yeah. Yeah, absolutely. So right now we're in talks with, several of the applicant tracking systems out there, working on integrations. We're so fortunate to have our CTO, Kier, that has a lot of integration experience directly in healthcare technology. So I think, step one is to come in there and integrate and help provide an immediate solution. And then as we continue to grow, one at a time, we're going to pick off these pain points and continue to automate, over and over and over again in terms of, what needs to be fixed and what is really taking away from that human element. And over time, build different integrations that, makes us the central hub for everything that the recruiter is, living in every day, the traveler's living in every day. And we're going to have our weak points as well, where, we're not a payroll company. We don't know how to run payroll. So we're going to integrate with the payroll systems that make sense. So integrate where it makes sense, build things where we think we can improve upon the current technology.
That's excellent. Very much needed in this space. And I can tell you there are a lot of clients that we work with here at Moxie that could benefit from that technology. So how do agencies get in touch with you guys? Let's say they watch this and they're like, you know what, we want to learn more about this. We want to kind of demo the platform. We want to learn more about how it works. How do they contact you?
Yeah, great question. So online, we're at kamanahealth.com. It's KAMANA, kamanahealth.com. And then Dave, John, it's just John at or Dave at kamanahealth.com. You can reach us directly. You can also chat with us right there on the website. And we are, just like we feel like the human element is important in your world, we are people here too. And if you come to talk to us and show us a demo, you're looking at the two guys that are going to come out and have a conversation.
Excellent. Thanks so much for joining me, guys. I've talked with you both a few times now, and it's always a pleasure. I love what you guys are doing. I love what you stand for. One of the things that I want to say is that you guys are all about creating a better market for everyone, for all parties, and just improving the overall experience for travelers and agencies. And it's clear, based on my conversations with you, you guys are making the right moves to make that happen. So thanks again for joining me. This has been great. And we can probably do this again sometime soon. I think we'll have some more questions maybe that pop up that we can answer.
Yeah, absolutely. And likewise, Adam, and we truly admire what you're doing out there too. I think that, everyone out there could use a little bit of help from a partnership and collaboration opportunity. And it's partnerships like you're going out there and forming with these agencies, and partnerships that we're looking for that, we think we can, work together to kind of move this industry forward as a collective unit and work with each other instead of against each other.
Absolutely. Couldn't agree more. Thanks again, guys. I appreciate it. Take care. Till next time.
Talk soon.
All right.